discussion is Paget disease, which is basically the disease of musculoskeletal, and it involves basically bones. In this disease, the rate of bone formation is less, while the rate of bone destruction is high. So we can say that Paget disease of bone is characterized by one or more bony lesion having high bone turnover and disorganized osteoid formation. And these two things, like high bone turnover, means high destruction rate of bone, and disorganized osteoid formation, uh, in which the bone marrow organic part matrix involve, and this lead to the disorganized bone formation, and these both phenomena ultimately lead to the development of Paget disease. And in this case, the involved bone becomes vascular weak and also deformed. So in this disease, it is a disease of the elderly, and very rarely it can be seen before the 40 years of age. And if it is seen, then mostly identified incidentally on the radiography, or in case of raised alkaline phosphate in about 27% of patients. And few patients are symptomatic at the time of diagnosis. And if you talk about the bones which are principally affected in this case, and these bones include pelvis, femur, tibia, lumbar spine, skull, and also scapula. And if you talk about the pathogenesis of this disease, then the primary abnormality is the increased osteoclastic bone resorption, which is accompanied by narrow fibrosis, increased vascularity of bone, and decreased osteoblastic activity. And the genetic factor may, in this case, the genetic factors are clearly important, and family history is present in about 15 percent of the cases, and in some cases, the exact cause is unknown. And if you talk about the clinical features, the classic presentation of the bone is in Paget disease is bone pain and pathological fractures, because the bone becomes soft, leading to the bone bored tibias and kyphosis, which is the forward bending of the vertebral column, and the frequent fractures occur with slight trauma. If the skull is involved, uh, then the patient may report headache, increased head sight due to the fibrosis or due to the compensatory mechanism, and deafness because affected bones enlarge and encroach the nerve foramina, so which ultimately lead to the deafness in these patients. And also, the increased vascularity over involved bone cause increased warmth, and which also can precipitate high cardiac output failure. Osteosarcoma is also present, may also be present, but it's a rare complication. Um, if we talk about the investigations of the Paget disease, then how can we confirm the disease? So serum calcium and phosphate levels are normal, but the serum alkaline phosphate is markedly high. Um in this disease, there is no demineralization. Only the bone turnover is high and the disorganized osteoid formation occur. Uh, Urinary hydroxyproline is also elevated in active disease, and this elevated amount of hydroxyproline is due to the collagen breakage. On X-ray, the involved bone is seen to be expanded and denser than the normal, and multiple fractures may be present in the long bones. If we perform the bone scan in these patients, and so that scan can detect the disease even before any X-ray changes are apparent. If this disease progress, it ultimately leads to the complication, which includes fracture on minimal trauma. Even a minimal trauma cause of bone fracture, kidney stones, if there is immobilization and spinal cord compression due to vertebral collapse. And in long standing cases, osteocarcoma is also a complication. and high output cardiac failure due to increased vascularity of bones, and cranial nerve palsies, and stroke due to the skull involvement. If we talk about the management of the diseases, then biophosphonates are given, which are biophosphonates basically cause apoptosis of the osteoclast, and this disease basically occur due to the high bone turnover, high destruction rate. So, and biphosphonate basically halter the osteoclastic activity, and calcitonin nasal spray are also given. These nasal spray cause the regulation of calcium phosphorus by inhibiting the osteoclast and uh, inhibit the osteoclast by inhibiting the osteoclast, and also release from the cells of follicular cells of thyroid gland. So that was all about the Paget disease. Thank you.